You are preparing to initiate tube feedings for Mrs. Devon, who will receive a continuous enteral infusion. Always check the expiration date and the integrity of the container. The formula should be at room temperature and shaken.
Other supplies you need include a 30 milliliter or larger luer lock or catheter tip syringe, stethoscope, pH indicator strip, disposable gloves, infusion container or bag, and tubing. An infusion pump designed for feeding tubes is required when feedings are delivered continuously or to the intestine.
Mrs. Devon, I'm going to listen to your stomach. I want to see if I can hear any bowel sounds. This lets me know whether you're digesting your food or not.
Always auscultate for the presence of bowel sounds before initiating a feeding. An absence of bowel sounds may indicate a decreased ability to digest or absorb nutrients. If there are no bowel sounds, report this to the physician before initiating or continuing with enteral feeding. Place Mrs. Devon in high Fowler's position or elevate the head of the bed 30 degrees. Then wash your hands and put on gloves. Because you are hanging a new bag of formula, it is important to confirm proper tube placement and to assess gastric residuals. This must be performed at least once every 8 to 12 hours and before medications are administered through the tube. Draw up 30 milliliters of air into the syringe, attach to the end of the tube, and inject the air. Then, aspirate gastric contents to check for gastric residual and to measure the pH of the gastric aspirate. A gastric residual greater than 100 milliliters may indicate delayed emptying, which should be reported to the physician.
And this goes back in.
Return aspirants of less than 100 milliliters to help prevent fluid and electrolyte imbalance. A gastric pH of 1 to 4 is a reliable indicator of proper tube placement in the patient's stomach. Hang the filled feeding container and tubing on the IV pole. Insert the tubing cassette into the infusion pump and set the prescribed rate. Allow the pump to prime the tubing. Then, connect the tubing to the proximal end of the feeding tube. Remember, the maximum hang time for formula is 8 hours in an open system and 24 hours in a closed, ready-to-hang system. Start the infusion at the current prescribed rate. Remember, an initial infusion is usually regulated at a rate of 30 to 50 milliliters per hour. It is then increased by 10 to 20 milliliters per hour per day as tolerated to achieve the target infusion rate.